I am Ruth McEwen, Advisory Council member serving on the Northwest Senior and Disability Services Advisory Councils. I want to welcome candidates, incumbents, and Advisory Council members to the 2024 Candidate Interview Forum. This program features candidates and incumbents from districts serving Clatsop, Marion, Polk, Tillamook, and Yamhill counties, and is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grant-funded programs. The mission of the Northwest Senior and Disability Service is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide to consumers includes information, assistance, in-home and community-based services, financial and medical help, meal site and home-delivered meals, options counseling, adult protective services, Medicare counseling, and peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to our candidate interviews. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member from the advisory councils, and then candidates will have the opportunity to answer questions which will be timed. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disability.
Hey there, my name is Monica Adams. I am a member of the Disability Services Advisory Council at Northwest Senior and Disability Services, and today I am interviewing Lori Chavez-DeRemer. She is a Republican candidate for office for U.S. Congressional District 5 here in Oregon and is currently the incumbent in that position. So we will be asking the Congresswoman several questions related to seniors and people with disabilities. Welcome, Lori, and thank you so much for sharing your time with us today.
Well, thank you for having me. I'm grateful to be here.
So for our first question, what have you done to advocate for seniors and people with disabilities, and what are your upcoming priorities for these populations?
Well, first of all, again, thank you for having me. I was looking forward to being here. A few of the things that I voted for in Protecting Healthcare for All Patients Act, which passed earlier this year in the House. The bill specifically ensures certain healthcare programs can't engage in practices that discriminate against people with disabilities. Specifically, insurance companies sometimes use prices that are based on quality adjusted life years to determine those thresholds for coverage and reimbursements. This puts a dollar value on the life of patients to decide if certain treatment cost is effective, and oftentimes discounting an individual's worth and need for care solely because of their disability or chronic illness. I'm also a co-sponsor of the bipartisan Social Security Fairness Act. This bill would fully repeal the windfall elimination provision and the government pension offset, which can result in massive cuts to retirees' Social Security accounts, specifically for public servants like teachers, police officers, and firefighters. A third, I am a co-sponsor of the bipartisan Social Security Investment Savings Penalty Elimination Act. This bill specifically would increase resources limits to use to determine the eligibility for the Supplemental Security Income Program. It takes into account the limits of $2,000 to $10,000 for individuals and $3,000 to $20,000 for married couples. So that's an increase for those limits. It would also ensure more disabled individuals receive the resources they need to ensure that those limits adjust for inflation.
Awesome. Thank you so much. So second question, The Older Americans Act provides critical programs for older adults in Oregon. How are you planning to protect and continue to increase funding for this act and for other aging and people with disability programs for FY 25-26?
Well, certainly throughout the appropriations process, I have fought to protect the critical programs like Social Security and Medicare. When the federal government was on the brink of debt crisis last year, if you all remember, I joined my colleagues to lead the Protecting Social Security and Medicare Act. It would have ensured that Medicare and Social Security payments were made in full, even if the federal debt limit had not been reached. And thankfully, we did reach a bipartisan agreement, which was entitled the Fiscal Responsibility Act. The bill will save taxpayers $2.1 trillion over the next 6 years while preventing cuts to critical programs like Social Security and Medicare. The two bipartisan appropriations that were signed into law with that act were the $100 million increase for Social Security Administration to improve operations for seniors, full funding of $4.1 billion for the Centers for Medicare and Medicaid Services, and full funding for the senior community service employment for older Americans. And as we continue through that appropriations process in the years, I'll keep fighting for those critical programs.
Great to hear. Thank you. How will you address food and nutrition insecurities for seniors and people with disabilities?
Well, certainly one of the most talked about things is food security. The fiscal year 2024 budget included $1.1 billion for senior nutrition programs, increasing and including funding for home delivered meal programs. That matters to so many of our seniors with disabilities. And as a member of the Ag Committee, I've been working to improve SNAP, which accounts for a majority of the spending in the Farm Bill. I helped introduce the SNAP Staffing Flexibility Act to speed up the processing of those SNAP applications. And I also helped introduce the bipartisan SNAP Nutrition Security Act, which would help find ways to improve access to healthy foods for those SNAP recipients. Both of these bills were included in the bipartisan Farm Bill that passed the Ag Committee in May.
That's good to hear. Thank you so much. What are you planning to do to assure Oregon seniors and people with disabilities on Medicare and Medicaid have access to behavioral health services?
Well, certainly what we want to pay attention to in healthcare is, I mentioned earlier, Protecting Healthcare for All Patients Act. It's a specific bill to prevent the discrimination against Oregonians with disabilities. Also expanding access to telehealth. We've heard that across many sectors. It's critical for making healthcare more accessible to a lot of our rural communities as well, and people who just don't have access in the urban sector. So I made sure that we paid attention to expanding that. I joined several of my colleagues to introduce the Bipartisan EASE Act. This bill would increase access to specialty care services for patients living in the underserved communities. Specifically, the proposal utilizes existing Center for Medicare and Medicaid Innovation and those funds to test the virtual specialty networks dedicated to providing that virtual care option. So again, connecting and accessing for a lot of the urban-rural divide and for people who just don't have the immediate access to get to their appointments. Protecting and expanding access to Medicare as well is a top priority for me and for my office. I'm a co-sponsor of Strengthening Medicare for Patients and Providers Act. And all these times, they're a little tedious, but I think it matters to most people to see the specific bills. The bill will provide the certainty to Medicare recipients by supporting physicians who treat those Medicare patients. And specifically, it would change the physician payment rate above the current law by providing annual Medicare physician payment updates tied to inflation. And I think that that's what we need the most, is that tied to inflation, so we make sure we're modernizing and being able to care for our patients.
It's great to hear that so much time and thought has gone into that. Final question. It's become increasingly challenging for seniors and people with disabilities to obtain housing due to rising housing costs here in Oregon and insufficient supply of disability accessible housing as well. What are you planning to do on a federal level to prioritize affordable, accessible housing?
Oh my gosh, again, a number one priority amongst all constituents, but specifically in our seniors and our seniors with disability. I recently co-sponsored a bipartisan Housing Supply and Affordability Act. Oregon has the second highest percentage of homeless who are unsheltered, and I've been working toward bipartisan solutions that would address the housing shortage to help fix that crisis. This bill sends federal resources to Oregon communities, creating a grant program to ensure they have more tools available to support the affordable housing projects. As a former mayor, I'll keep engaging with our local governments to solve the problems of housing shortages that have limited economic growth and opportunity. One of the bills that we recently passed, bipartisan tax bill, was the Tax Relief for American Families and Workers Act. That includes a provision to expand affordable housing by enhancing the low-income housing tax credit. I'm a co-sponsor of 2 bills that would help construct thousands of new homes in under-resourced communities over the next decade: the Affordable Housing Credit Improvement Act and the Neighborhood Homes Investment Act. Separately, I'm leading a bipartisan bill with Congressman Cleaver of Missouri, known as the Choice in Affordable Housing Act. This bill would reform Section 8 housing vouchers, that program specifically, to allow higher numbers of vouchers to be used across more neighborhoods. Oftentimes, we're not thinking about the flexibility of a lot of these programs. And so we want to expand that language that includes all vulnerable communities, and specifically our senior housing and seniors with disabilities.
Great to hear that this has been such a priority. We really appreciate that, as it's what we are here to advocate for. We really thank you for being here with us today. Once again, for everyone, you've been visiting with Lori Chavez-DeRemer, the Republican candidate for U.S. Congressional District 5 in Oregon. Thank you again, Congresswoman, for joining us today for this interview. We really appreciate it.
Thank you for your time, and I look forward to visiting in the future. Reach out to my office anytime.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and Disability Service Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, call 1-866-206-4799. The advisory councils for Northwest Senior and Disability Services would like to thank Capital Community Media for their production of the forum. Thank you for watching.